Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. I have lots of questions that I've written down from all the emails that I've been getting lately in the comments. So thank you guys. Thank you to everybody who submitted a question. But I wanted to discuss something today before I get into the episode. So I want to talk about information sharing, okay? When I got back from conference, right, I had some slides and things like that from some of the classes that I had attended, and I was trying to give them to my supervisor, and just so that I can share what I learned while I was there, And so I called her up and I told her, oh, I have these slides, would you like them? And she's like, I don't want no more paper. I don't want any more paper, Blue. I have too much paper. So I was like, okay, well, fine. All right. I mean, I'm just trying to share information with you, but okay. So we hung up, okay, cool, and so I took him to a coworker and I talked about it with her because she was interested in some of the things that I had, some of the slides that I had. And she was very grateful. She was like, oh, thank you for your help. I appreciate all this information. So it's good to pass along this information. Well, I come back to my desk and there's an email from my supervisor asking me what was the slides that I wanted to show her. So when someone is trying to share information with you, it's so that you can be more informed. We are all in this together, all as medical coders. We are all in this together. It does not matter who is bringing you this information. If they have a resource, take it. Take the resource. Even if you don't want to look at it that moment, that's fine. Just put it away and read it later. At least that's what I do, whenever I have information that I need to read and I don't have time to read it. So just a word of the wise, if you have information, share it. And if people don't want it, then that's fine. Find somebody else. Somebody else will want that information. I'm just saying. So the other part of that is today, new technology has come to my facility and I'm very excited about it. So the orthosurgeons are now using this Mako machine, Mako. Okay, it's called a Mako machine, and it's very good at the joints surgeries, right? And getting exact measurements and things like that. It's a wonderful thing, and there's a code for it. So while everybody's very excited today, there's a lot of buzz going around in the clinic about this new procedure, and of course, Dr. X is first up with this new procedure. So he's up in the OR. We're all talking about it, and one of the surgery techs came over and was talking to me and was describing everything that it does, and I'm so fascinated. I'm like, oh, and not really thinking about it at that moment because remember, I'm not the surgery coder for the facility. So but it's okay. I've done plenty of surgery coding before, and I've actually worked with the surgeries for my facility, but because of the workload, the amount of work, it really is only for one person. So another lady has it, but I can still help out whenever I need to. Anyway, so I'm not really thinking about looking up the code or anything like that. Well, then I talked to somebody else, one of the other PAs, and we were talking about this Mako thing. And she was excited about it. So I said, you know what? I wonder what the code would be. So I went back and I started looking up the code myself, just to see what kind of code would come up with. I couldn't quite get it in the encoder, so I started looking online and I found the code. So I was like, wow, and I'm looking up the code and researching it and making sure that everything is good. Well, Dr. X comes down and he's in his office, and I go over there and I said, sir, I know that you're working on the Mako with the Mako today. How did that go? He was like, oh, it was really neat, because he'd taken a class for it and everything. And I said, well, here's the code that I found for this Mako thing. And he's like, wow. He goes, I was wondering, like, what code was I going to use? What do I need to document? So I reviewed with him what he had, for his surgery documentation to make sure that everything was on there. And like he's saying, the necessity of using this machine and all everything that was in it. And so everything is, of course, perfect because he's very brilliant and he does really good documentation. So I gave him the code, and so he's like, oh, wow, this is neat. And so since he was first up with it today, he did say some of the other surgeons were going to be working with it as well. So I told him that I would go ahead and send it out as a coding tip of the week. And then I reached out to the surgery coder and I told her too, because I didn't want her to be blindsided as far as like, oh, they're doing this new procedure and, they're documenting all this stuff and, what is the code. So I went ahead and sent her a couple of articles that I found, and I told her, I said, well, I just want to pass along this information. That's all I'm doing is just sharing. It is totally up to you. I know this is your lane, but I just wanted to share with you that orthopedics got a new toy. So, and so she writes me back and she's like, oh my goodness, thank you so much for this information, and I appreciate it. She goes, I'll be looking out for these because she's the way she's working the list, it'll come to her soon. So I was like, okay, cool. Again, you don't know how people are going to react to you when you're sharing information, but I still do it anyway. And I mean, I've gotten scolded more than once for sharing information, but to me, it's just like, if it's there, it's a resource that everybody can see. What is the point in not sharing it? I'm not one of those. If you ask me for help, I'll help you. But as long as I know that you're trying to help too, like you're trying to absorb it, or you're not just trying to blow me off, you know what I mean? Of course I'm going to help you. That's just the way that I am, so. Oh, well. But good communication, and this was really good. So Dr. X was very happy with this, and the surgery coder is well aware and she's informed. So, oh well. I'm very excited for this though. It's like, oh my gosh, I am such a nerd. I was like freaking out because I was like so riveted by this new technology, because the things that they come up with in medicine, I mean, or for surgeries, is just amazing, But anyway, let me go ahead and get into the questions. So, number one, the difference between when you're in school between medical coding and medical billing and coding. Somebody had asked, should they take a medical coding course or should they take a medical billing and coding course? The answer to that is long and short. I when I went to school, they did have a billing section for my course, because I took a medical coding course and there was a section about billing. The more information, the more informed you are about this field, the better off you'll be. So, it's up to you. I would only suggest that you don't take a very short course, because you really should take the time to learn things, especially if you're going to be investing in taking the certification exams and then, making sure that you stay on top of your continuing education units, and if you have to pay for those and things like that, because some employers will offer that as a benefit of employment. Where I work, I don't have to pay for CEUs because it is a benefit of my employment. So it all depends on where you are. But, the more credentials you have, the more CEUs or continuing education units you're going to have to produce. So something to keep in mind. But I always recommend taking a course that will give you the most information possible about this field. Okay. The next one is, did I have to buy the books for school? So my books were included with my school. I went to a trade school and it was included with the payment for the school. So I didn't have to buy them separately. The only thing, that I did buy separately was like flashcards. Like I actually got some flashcards from Barnes & Noble as well. And then I did some actual handwritten flashcards, and my mom did handwritten flashcards with me too. So that was some of the investment that I did. I bought a dictionary, a medical dictionary. I got that. I had got one from the school, but I got another one because it was like bigger and expanded from Goodwill. So, Goodwill has a lot of good resource books there too as well. So you just have to go in and check out what they have. Or any thrift store. It doesn't necessarily have to be Goodwill. It can be any thrift store. So just be sure to check it out. But those were the things that I bought when I was in school, just to sort of, get more familiar. Had I known there was all these other cool books, I would have definitely got into those. But, I didn't know about those at the time. So anyway, but yeah, that was that. The next question is my thoughts on the 3-day coding schools. So I guess there's AAPC that does it. Or maybe another organization does it. I don't know anything about those schools. I don't know about their curriculum. I don't know what they're offering, or what it is that how they're teaching, or how fast they're going through the program. But keep in mind, even if you do pass this test, whether you take a 3-day course school, or whether you're taking a online course, or like going to a trade school and doing it for months, you can pass a certification exam, but once you get out into the real world, you have to make sure that you have a good foundational knowledge, because book coding is going to be a lot different from real world coding. The best way to arm yourself and be ready for the real world is if you educate yourself as much as you can. And for all my folks that are watching that are going to be starting their school in January, because I've had quite a few, they're going to be starting in January, so congratulations. And that is a wonderful new step towards your future. Now is the time to start getting familiar with medical terminology, anatomy and physiology, and pathophysiology. That's something that you can go ahead and start with. Get a good foundational knowledge, because having that good knowledge of the body beforehand is going to make things a lot easier for you once you get in. Because I look at it like the looking up the codes part is very easy. It is understanding what everything means that can get confusing. So just some advice from me to you. If you are about to start school, get ready by arming yourself and getting ready with medical terminology and anatomy and physiology, pathophysiology. Start there. Learn as much as you can before you start getting in there. Just saying. Prepare yourself. All right. The next one is, does it take long to find a job once you get your certification? So there is a saying, I guess, or maybe it's just commonly known. For every $10,000 a year you expect to earn, you should expect to be looking for a job for a month for every $10,000 you expect to earn. So if you're expecting to earn, $30,000, you're looking for at least 3 months, you're going to be looking for a job. Now, it's just a saying, it's not necessarily hard and fast, I looked for work for almost 2 months after I got out of, once I got my certification. And I continued to work in the bars and the halfway house and at the concession stand. That was the hard work that I was doing. And I was trying so hard to get into medical coding. So you will encounter, like 98% of you will encounter a lot of closed doors in your face. Unless you know a place that's going to hire people with absolutely no experience, then maybe you can get lucky. But those places are few and far in between. A lot of places are going to want you to have 2 years of experience. Now, how do you get experience if no one will hire you? I had to go through a temporary agency, and this temporary agency specialized in medical fields. So like for nurses, LVNs, doctors, medical coders, medical transcriptionists, that was all in one house, and they, that was their temporary agency. That was their specialty, was all medical. So that was how I was able to get my foot in the door, because they didn't expect me to have all this experience, because they just want a body basically in a chair to work. And so they knew that I didn't have a lot of experience, that I had no experience at that point at the temporary agency. But then when I went out on assignments, they knew too. I had gotten my first assignment was at the Cancer Therapy Center, and I was able to look at, being brand new and new to this field and knowing nothing about the real world of coding. So that position taught me a lot. So you know. But that was how I was able to do that, because I was able to put that all my time there on my resume, and that was how I was able to build it up. And the second job I got was from the same temporary agency, and that's what, you know, led me to a longer term position. And then, you know, after that, I was able to gain more experience, and that is how I was able to get where I currently am today. So it took time. You know, this isn't something that, you know, you can get in right away and real easy, you know. And it literally makes me crazy when I hear people, you know, talk about all of the money that medical coders make. And please do not ask me how much medical coders make, because there is a website, the Department of Labor, or dol.gov. They talk about different occupations and what they pay and what their long-term job outlook is. So that's something that you can reference if you are looking to see in your area how much a medical coder makes. Because like I said before, different areas in the U.S. Start their coders at different prices. When I was applying in my hometown, I literally started at one place. And then I literally went down the street, and it was $5 more for a medical coder. And then I went a little bit further down the street, and it was $3 less than the $5 one. So it's just different everywhere. But dol.gov will let you know a good range of what salary is for medical coders in your area. So if you are curious, be sure to check that out, because if you ask me, I will give you that link. All right, next question is there part-time or evening positions for coders? Of course. There are some places, some companies that allow you to work from home, or work in the evening, or work part-time. You know, it just depends on where you're applying, you know. You just have to look for the position and look for, you know, a scheduled time that works for you. And, you know, but it is like, medical coding is like any other field, you know. It's going to be different hours, and some companies, I guess, allow their coders to work whatever hours they want to, like whatever hours of the day. So it just depends, you know. So be sure to check it out and ask. The next question is this a good field for introverts? If you are an introvert, it takes all types to be a medical coder. If you are extrovert or introvert or somewhere in between, this is a good field, you know, as long as you know good reading comprehension, right? And as long as you understand the guidelines and you follow the rules, this is a good field, you know. It doesn't, I mean, not every coder is as nerdy, like flamboyantly nerdy like me. That's what I like to say now. Not everyone is like me. So you won't always encounter people that are like me. Sometimes you may find people that are like me times 10, you know, and then some people that you work around may be a little bit quieter, you know. So I am not a loud person, like normally, like running around or whatever. But when I get excited about things, like, of course, medical coding or something else, I do get a little, you know. So that's how I get, like today. So I saw all of my good work, right, paying off, right? I have a one of my other orthosurgeons. When he started, he I still remember, he was like, he goes, I'm not doing that. I'm not doing that. And I was like, okay, you know. So I'm talking to him, and I'm trying to help him understand and things like that. He goes, this is stupid. I said, I understand, you know, because he hadn't had exposure to a hands-on coder like me before. And so after working with him all of this time, you know, like, there was a specific scenario that I've talked about, and not only did he select the correct diagnosis code and the correct E&M code, but his documentation was perfect. I mean, he does really good all the time, you know, but like literally sometimes I have to like change a code as far as like make it more specific, or change it because documentation or whatever. But everything was right on. So I sent him an email to let him know. And I said, sir, I said, there's happiness and then there's next level. Okay, which is gleeful, right? I said that's where I am, and I described to him what happened and told him, awesome. That was really awesome to see that how he had selected those codes so correctly, because this was a very like I said, it's not a usual occurrence, So the fact that he did it on his own by himself, and I'm just basically looking at it and verifying everything is there. And it was there. So I was very happy. I'm like, I don't know whether to laugh or cry. Again, that is the part of me that is flamboyantly nerdy, So I sent him that email. And of course, I'm sure he's going to be laughing at me tomorrow, But that is all a part of being a medical coder. So like I said, it takes all different types, okay? Some people are more stronger than others. Some people come in with a more gentle approach. It all depends. But like I said, if you've got those key things down, like a good grasp of reading comprehension and a good background in anatomy, physiology, you'd be totally fine. So if you are interested in it, do more research and find out if it is right for you, if that's what you want to do with yourself, because it is an investment. I will say that too, and I don't think I've really said it too much, but it is an investment in yourself, totally, because you have to make sure that you are always going to be willing to stay on top of things and like studying and reading and things like that. So if you're into that, it is a good field. I mean, I love it, and like I said, today was just one of those days. It was just like, this is really awesome. So anyway, all right. And then the last question is Aftercare on different body systems. Explain the spine. All right. I'm looking at my watch because I got to get going here in a minute. So the spine, when you're talking about Aftercare for the spine, right? So it depends on what the surgery was for, okay? If it was for, let's say, nerves on the spine, of course it would be Aftercare for neurological condition, because if it has nothing to do with the bones and all to do with the nerves, then you're going to code it as orthopedic Aftercare following surgery on the nervous system, okay? Now, if it is about the bones, if you're looking at like the spine as far as like the vertebra and, things like that, you're looking at bone work, or discs, things like that, you're going to be looking at orthopedic Aftercare. So it all depends on what you're looking at. Like with carpal tunnel, that is not orthopedic Aftercare. That is Aftercare following surgery for a neurological condition, because carpal tunnel has to do with the nerves. Okay, even though they have to, sometimes they do it endoscopically, or they have to open, and then I'm sure they're moving around things in there. So, but it's not orthopedic Aftercare. They may do it in the orthopedic setting, but it's not orthopedic Aftercare. It is nervous system Aftercare. So always pay attention to what the condition is and what does it fall under. So that is something to really pay attention to. And again, that is going to go back to making sure that you're not only looking at the book, but reading like the coding tips around the Aftercare, so that way you can make sure that you are, in fact, using the correct Aftercare code. All right? So, but yeah, that's going to go ahead and wrap it up for today. Friday, for Quiz Friday, even though I know we're only on Tuesday, but I'm telling you, my week is already, because of the weekend. Quiz Friday is going to be again about urology, because I did get a very good suggestion about kind of sticking with one topic for like the month. So I think because I know that we did urology this last Quiz Friday, I'm just going to go 4 weeks. So this would be week 2 of doing urology Quiz Friday. So this way we can go ahead and just concentrate. So if you have particular questions about urology, let me know. So that way maybe I can do another Q&A about urology, as well as, more questions for Quiz Friday about urology. Not to say that I won't try to throw in an extra other specialty question or two, but most of it will be urology, just like this last Quiz Friday. All right? So that is going to wrap it up for me, because I got to get going now. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on the next video. Bye.